What if your body was warning you about a heart attack, but you didn't recognize the signs? Every year, millions of people experience a heart attack, and many of them never see it coming. That's because the early clues can be confusing, subtle, or even silent. But knowing exactly what to look for could save your life or the life of someone you love. So what are the signs of heart attack? That's what we're going to uncover today. And we're not just talking about the obvious ones like chest pain. Some symptoms can feel like indigestion, anxiety, or even flu-like discomfort. These are the kinds of signs that often get missed until it's too late. In this video, we'll walk you through the earliest warning signs of a heart attack, how to tell if it's serious, and what actions you need to take immediately. Because when it comes to your heart, every second counts. If you've ever asked, what are the signs of heart attack, and how can I catch them early? You're in the right place. Stay with us and arm yourself with the knowledge that could make all the difference. 1. What are the signs of heart attack? When we hear the word heart attack, most people immediately picture someone clutching their chest in pain. While that's one possible sign, it's far from the only one, and many people don't experience it at all. So, what are the signs of heart attack you really need to know? Chest discomfort is the classic symptom. This can feel like pressure, squeezing, fullness, or pain in the center or left side of the chest. It usually lasts more than a few minutes, or it may come and go, but it's not always severe or dramatic. Some people describe it as tightness, or even just a strange sensation. Then there's discomfort in other areas of the upper body. Pain or numbness can spread to the arms, shoulders, back, neck, jaw, or stomach. Women, in particular, may feel pain in the upper back or jaw more often than men. Shortness of breath is another key symptom, especially if it comes on suddenly or during rest. It might be accompanied by chest pain, but sometimes it's the only sign. You might feel like you can't get enough air or that breathing is unusually difficult. Other warning signs include breaking out in a cold sweat, nausea, lightheadedness, or sudden fatigue. You might feel dizzy or weak, or you may even lose consciousness. These symptoms can develop gradually or appear all at once. It's also important to recognize the timing and setting of these symptoms. Signs of a heart attack can occur during physical activity, rest, or even while you're asleep. They can be triggered by stress, exertion, or seemingly nothing at all. What makes this more dangerous is that many people don't connect these symptoms to their heart. They may think it's heartburn, anxiety, or the flu, especially if the pain is mild or the symptoms are unusual. Understanding what are the signs of heart attack means recognizing both the obvious and the subtle. No symptom should be ignored, especially if it's new, unexplained, or just doesn't feel right. The quicker you act, the better your chances of survival and recovery. Number 2. Early signs you should never ignore. The danger with heart attacks is that the earliest warning signs often don't seem serious. They might even feel like normal reactions to a busy day or a stressful moment. But when you understand what to watch for, you'll know the difference between something minor and something your heart is trying to tell you. So what are the signs of heart attack that show up early, sometimes even days or weeks in advance? One of the most common is persistent fatigue. This isn't just being tired. It's an overwhelming exhaustion that doesn't go away with rest. You might feel drained doing things that never used to be a problem, like walking to the mailbox or going up a single flight of stairs. Sleep disturbances can also be an early red flag. Many people report struggling to fall asleep or waking up suddenly in the night, feeling anxious or short of breath. This can be your body reacting to changes in blood flow or heart rhythm, even before chest pain begins. Shortness of breath is another early clue. If you're struggling to breathe during simple tasks or feel winded without exertion, that's not something to brush off. It could signal that your heart isn't pumping efficiently. Nausea, indigestion, or a bloated feeling can also be early signs, especially in women. These might be mistaken for a stomach bug or acid reflux, but if they come with other symptoms like lightheadedness or chest discomfort, don't ignore them. Anxiety or a sense of impending doom is a symptom many people experience before a heart attack. It's more than stress, it's a gut feeling that something is deeply wrong. Pay attention to it. If you notice any combination of these symptoms, especially if they're new, worsening, or unusual for your body, it's time to talk to your doctor. Write them down. Track how long they last, how often they occur, and what you were doing at the time. Catching these signs early can make all the difference. It means getting help before a full-blown emergency and potentially saving your own life. 3. What to do immediately if you notice the signs. Recognizing the signs of a heart attack is only half the battle. What you do next can mean the difference between survival and tragedy. So what should you do the moment you suspect something might be wrong? First and foremost, don't ignore it. If you're asking yourself, what are the signs of heart attack and am I experiencing them? Take that question seriously. Too many people downplay symptoms, hoping they'll pass. But heart attacks can escalate quickly. Best that, and every second counts. If you're experiencing chest pain or pressure, especially if it lasts more than a few minutes or comes with shortness of breath, lightheadedness, or pain in the upper body, call emergency services immediately. In the U.S., dial 911. Do not attempt to drive yourself to the hospital. Emergency responders can begin life-saving treatment on the way and get you to the right facility faster. While waiting for help, try to stay calm. Sit down, rest, and avoid any physical exertion. If you've been prescribed nitroglycerin, take it as directed. Chewing an aspirin, unless you're allergic, may also help by thinning the blood and potentially limiting damage to the heart muscle. But don't take any medications unless advised by your doctor or emergency services. If you're with someone else who might be having a heart attack, act quickly. Call for help, make them comfortable, and monitor their condition. If they lose consciousness and aren't breathing, begin CPR immediately if you're trained. Every moment of hesitation can increase the damage done to the heart or reduce the chances of survival. Even if the symptoms go away after a few minutes, you still need medical attention. Some heart attacks come in waves. Pain can stop and then return. Or you might be having a silent heart attack with less obvious symptoms. Either way, the danger doesn't pass just because the pain does. Another critical step is to be honest and direct when you reach the hospital. Explain what you felt, when it started, and how intense it was. Don't minimize your experience. Describe everything, even if it seems small or strange. The more information doctors have, the faster and more accurately they can treat you. Acting quickly can preserve heart tissue, reduce long-term damage, and most importantly, save your life. When in doubt, always treat it as an emergency. Trust your instincts, because when it comes to your heart, it's always better to be safe than sorry. 4. How to reduce your risk, starting today. The best way to handle a heart attack is to prevent it from happening in the first place. While some risk factors are out of your control, like age or family history, many others are completely manageable. The key is taking daily action. Starting now, begin with your diet. Choose heart-friendly foods like fresh fruits, vegetables, whole grains, and lean proteins. Cut down on saturated fats, trans fats, and added sugars. Foods rich in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, help protect the heart by reducing inflammation and supporting healthy cholesterol levels. Exercise is another powerful tool. You don't need to spend hours in the gym. Just 30 minutes of brisk walking most days of the week can lower your blood pressure, improve circulation, and strengthen your heart. If you've been inactive, start small and build up gradually. Quit smoking and avoid secondhand smoke. Smoking damages blood vessels, reduces oxygen to the heart, and makes your blood more likely to clot. The benefits of quitting begin almost immediately and grow stronger with time. Manage stress intentionally. Chronic stress affects your hormones, increases blood pressure, and can lead to poor choices like overeating or skipping workouts. Simple habits like deep breathing, meditation, journaling, or even just getting outside in nature can help restore calm and improve heart health. Keep tabs on your numbers. Know your blood pressure, cholesterol, and blood sugar levels. These numbers give you insight into your cardiovascular health. If they're not where they should be, work with your doctor to make a plan. Don't wait until symptoms appear. Sleep well and consistently. Poor sleep increases your risk of heart disease, especially if you have sleep apnea or struggle to get enough rest. Aim for 7 to 8 hours of quality sleep per night and talk to your doctor if you feel constantly tired despite sleeping. Lastly, stay connected. Social isolation is a real risk factor, especially in older adults. Meaningful relationships reduce stress and offer emotional support, which is vital to overall health and well-being. Heart health isn't about perfection. It's about progress and consistency. The small choices you make today, what you eat, how you move, how you handle stress, can shape your heart's future. Start now. Your heart will thank you. Now you know what to watch for, because the signs of a heart attack aren't always obvious, and time is everything. When it comes to your heart, trusting your instincts and acting fast can save your life or someone else's. So, what are the signs of heart attack? They're not just dramatic chest pain. They can be subtle fatigue, pressure in unusual places, shortness of breath, or even unexplained anxiety. Don't wait for all the symptoms to line up perfectly. If something feels wrong, act on it. Preventing a heart attack is even more powerful than surviving one. With daily choices, you can lower your risk and strengthen your body's defenses. Eat better, move more, manage stress, and stay informed. Your heart works hard for you. It's time you return the favor. If you found this video helpful, please like, share, and subscribe to ActiveHealthCare. We're here to give you real tools for better living, especially when it matters most. Don't forget to hit the notification bell so you never miss out on life-saving knowledge. Thank you for watching. Take care of your heart, because it's the only one you've got.